This is a Hints from Howard, Restorative Problem Solvers. Today we'll be talking about contemporary dental cements. I'm Howard Strassler. So what are we cementing today? We're cementing restorations for the anterior and posterior made of all metal, high noble, low noble. We're also cementing porcelain metal restorations from a variety of metals. We're cementing CAD-CAM restorations that are milled from composite nano ceramics, as well as ceramic restorations, either pressed, zirconia restorations, CAD-CAM restorations of a variety of different ceramics, as well as we're cementing posts for the endodontically treated tooth, whether they be cast posts and cores, prefabricated metal, or fiber posts. In the past, our choices were legacy cements: zinc phosphate cement, zinc polycarboxylate, zinc oxide, and eugenol. But in the last decade, we've seen major shifts and trends towards the use of contemporary cements: composite resin cements, self-cure composite resin, light-cure composite resin cements, and the most popular dual-cure, self and light-cure components for polymerization. We're using more glass ionomer cements, whether they be self-setting with an acid-base reaction or resin modified, where we see an acid-base reaction with a 10% resin within this glass ionomer. When we speak about composite resin cements, they're not just one single category, they're a category of many choices. In fact, for composite resin cements, our choices include etch and rinse adhesive, self-cure composites, etch and rinse adhesive dual-cure composite cements, self-etch adhesive dual-cure cements, self-adhesive composite resin, and etch and rinse adhesive composite cements that are light cure only. When we look at dual-cure etch and rinse cements, they require etching with phosphoric acid for 15 seconds, rinsing the surface for 10, and then drying them off. We're then using dual-cure adhesives, and we're using a self-mixing dual cartridge to dispense these cements. And these cements are the most all-purpose of all composite resin cements that we can select. We also have self-adhesive composite resin cements have become very popular because of the simplification. They don't require a separate adhesive step, that it's mainly either mixed through a self-mixing double-barreled cartridge, or they're in capsules that are mixed on triturators that are then syringed onto the restoration. We're also using light cure composite resin cements, and these resin cements that are light cure are predominantly for porcelain veneers because the veneer thickness allows the light energy to penetrate through the ceramic and activate the composite resin. Resin Modified Glass ionomer cements are a good all-purpose cement. There are a number of different varieties, and most of them today are auto-mixing. There are some powder liquids out there. My preference has been towards the auto-mixing systems. And whenever we talk about using composite resin cements, we're also talking about, can we pre-treat the ceramic surface so that we can enhance the adhesion between the interface. And in the past, there were many limitations to what we were using. We were using primarily silane primers to bond to porcelain, and specific metal primers to bond to the metal-based ceramics, the zirconia materials. In recent years, some of our universal adhesives have eliminated this additional step by including the primer systems in their chemistry. You need to read the instructions for use for these materials to understand how you use each of the different products when you're cementing a restoration. So what do you use where? all the cements that are on the market are very predictable, very successful if used following the instructions for use. But knowing where you should use them depends upon the restorative material that the lab is using for the cementation for the restoration you're fabricating and placing. So when we talk about indications for each cement, it'll be based upon the type of restoration, and we'll list the cement that we'd use when placing that final restoration. So when we look at indications for cement, and we're going to look at glass ionomer cement first, whether we're using a self-setting reaction or the resin modified, we can use glass ionomer cements for all metal castings, porcelain metal restorations, metal posts, cast posts and cores, zirconia, or stainless steel crowns. We're using composite resin cements based upon their method of polymerization. For porcelain veneers, we're using a light cure resin cement. For all our other restorations, we can either use a self-cure or a dual cure system. Whether we're placing a porcelain metal restoration, an all-ceramic crown, inlay and onlay, no matter what type. For zirconia, for all types of posts and cores, whether they be metal posts and cores or posts or fiber posts. We're using self-cure and dual-cure resin cements for metal castings, for composite or ceramic inlays, onlays, and crowns, and for stainless steel crowns. So let's take a look at some cases and the cements I'm selecting. So for porcelain veneers, whether you're having the veneers fabricated with feldspathic porcelain, lucite reinforced porcelain, or lithium disilicate, no matter whether it's pressed or milled CAD-CAM, for these porcelain veneers, I'm using a light cured resin cement with a thin interface. My ceramic's been etched by the laboratory. I'm using an adhesive that has compatibility with pre-treating the etched ceramic, or I'm using a silane, and I'm bonding to an etched enamel surface or an etched dentin and enamel surface. And once again, for porcelain veneers, I'm using a light cure composite resin cement. And the reason for a light cure resin cement is for these thin porcelain veneers, I want a cement that has color stability, because if I see color shifting, I'll see a color shifting in the shade of the veneer over time. We need color stability. Light cured resin cements offer us that color stability. For porcelain metal restorations, and for this 3-unit fixed partial denture, I can use a variety of different cements and get success. And my choice is going to be for simplification. I'm placing it for multiple units, so I'm either using a resin modified glass ionomer or I'm using a self-adhesive composite cement. For an all ceramic restoration, anterior and posterior, made from lithium disilicate, whether it be a pressed or a milled lithium disilicate, for these restorations, the interior of the ceramic is being etched by the laboratory using hydrofluoric acid. I'm placing either a silane inside the ceramic, or I'm using a universal adhesive that will pre-treat that ceramic surface. And my choice can be a dual cure composite resin cement, a self-adhesive composite resin cement, or even a resin modified glass ionomer. Lithium disilicate has the physical properties that allow us to cement with all 3 different resin cement systems. For zirconia, once again, I have many different choices. I can use either a dual cure composite resin cement, a self-adhesive resin cement, or a resin modified glass ionomer. Zirconia will be very successful with all these 3 different families of cements. What about the tooth that you're going to be preparing for a partial coverage restoration? For this tooth, we've removed the composite amalgam and replaced it with a new composite core. We've prepared it, and the onlay that we'll be placing for this restoration is going to be either placed with a dual cure composite resin or a self-adhesive composite resin for a composite onlay. This was Howard Strassler with a Hints from Howard, Restorative Problem Solvers, Contemporary Dental Cements.